long-term outcomes of intracorneal ring segments.
Good morning, esteemed judges and my lovely friends. So, I'm Dr. Pranita Saha, and I'll be presenting on the long-term outcomes of intracorneal ring segment implantation with corneal cross-linking in keratoconus. So, as we all know, the management of keratoconus has two components. One is stopping the progression, for which CXL is the gold standard therapy, and the second is visual rehabilitation, for which glasses, contact lenses, Intacs, topo-guided PRK, and keratoplasty are used in a stepwise fashion based on the patient profile. So what is all known about Intacs is that it is US FDA approved and it works by arc shortening effect and helps in improving the visual acuity and refraction in patients of keratoconus. But certain disadvantages like corneal melt, ring extrusion and loss of CDVA has led to apprehensions for its use among refractive surgeons. Hence, in this study, we decided to assess the long-term visual and topographic outcomes of intracorneal ring segment implantation in cases of keratoconus to look at its results. The study was done at Center for Sight Eye Hospital at Tertiary Eye Care Center and included cases of keratoconus that underwent Intacs with CXL implantation and had an age of more than 18 years with a minimum follow-up of 5 years. The patients were operated between 2011 and 2016, were recruited for the purpose of study. The baseline and follow-up visual acuity, refraction and topography were recorded. The primary outcome was change in BCVA and the secondary outcome was change in refraction, topography and the adverse events noted. Coming to my results, 24 eyes of 20 patients met our inclusion and exclusion criteria. The gender distribution was 50-50 between male and female. The mean age was 25.8 years and the mean follow-up was 7.1 years. This is the follow-up breakup of the individual patients and the range for follow-up was 5 to 11 years. 54% of the eyes were in stage 1 KC, while 38% was stage 2, stage 3, and only 8% was in stage 4 KC that underwent Intacs with CXL. All eyes except one underwent 2 ring segment implantation. Coming to the visual acuity results, so there was a statistically significant improvement in the best corrected visual acuity from 0.29 logmar to 0.12 logmar at final follow-up. 55% of the eyes showed more than one line improvement in the Snellen's visual acuity chart. 40% the BCVA remained same, while only one eye had a loss of BCVA that was less than one line. The manifest refractive spherical equivalent also showed a statistically significant decline from minus 3.35 to minus 2. More than one diopter decline was noted in 55% eyes, and only one eye showed worsening of myopia. Now looking at the change in spherical power, it also showed a statistically significant improvement from minus 1.39 to minus 0.48. The cylindrical power also showed a statistically significant decline from 3.8 diopters at baseline to 2 diopters at final follow-up. The Q value on the pentacam, which is an indicator of your shape of the cornea on pentacam, showed an improvement from minus 0.8 to minus 0.47. Kmax showed a decline from 58 to 55, and K-mean showed a decline from 49 to 46, both being statistically significant. The thinnest pachymetry did show a slight decline from 452 to 419 at 3 years, following which it stabilized. Coming to the adverse events, Intacs was explanted in 3 eyes for corneal melt. The time from implant to explant was 8 years, 7 years, and 1 year respectively in case 1, 2, and 3. Vascularization of the channel was noted in 1 eye, and lipid deposition was noted in the channel for 2 eyes. This is a short video where we can see that even after a long term of implantation of Intacs, explant is not very difficult. A thin slit incision was made right over the Intacs ring, and with the help of a Sinskey hook, the hole was entangled, and it was gently moved out of the groove, pulled out of the groove in a circumferential pattern without damaging the overlying cornea. So the major complication rate was 12.5%, indicating that a lifelong follow-up is essential in these patients. Also, a logistic regression analysis for risk factor was done. However, none of these risk factors was found to be significant in indicating that whether the patient will have a major complication on long-term follow-up. This is a comparison of my study with the various other studies that have done a long-term outcome. However, what we found was different in our study was none of these study was giving a holistic idea of change in visual acuity, refraction, topography, and adverse event. We had focal information available in most of these studies. And the limitation of my study is it was retrospective in nature. While 54 eyes were operated during the study period, only 40 could be telephonically contacted and were doing well. Documented data was available for 24 eyes. Hence, the complication rate could have been overestimated. So to conclude, INTAX with CXL results in significant improvement in visual acuity, refraction, and topography. However, there is a high complication rate present, and a lifelong follow-up is essential in these cases. These are my references. Thank you.
Very nice study, Pranita. My one query to you, now that CARES is also available, so what do you think is the thing for INTAX versus CARES? Because here it's a foreign body, it's going to get extruded. You have a high 12.5% complication rate over a long period.
Yes.
And so do you think you would switch to CARES now?
Ma'am, CARES has been introduced a couple of years back. The long-term data is yet not available. I understand that this is a PMMA, and obviously in comparison to a corneal stroma, this may seem to be a foreign body, but CARES also is using a foreign body tissue. And the long-term results of how it is going to work is something we don't know. Yes, as at present, it is showing a very good improvement in the refraction, but the long-term results also need to be seen, whether that is going to be sustained over a long time or not.
Okay, the other thing is, you said the Kmax by 3 diopters is improved. So only with CXL also you see a lot of flattening.
Yes.
So do you think INTAX, what is the actual role of INTAX? How much percentage of your C3R patients or your keratoconus patients would you do INTAX? Because it's such an expensive procedure.
Yes, ma'am.
The femtosecond laser channels is expensive.
Yes, ma'am.
Plus the INTAX is also expensive. And then you tell the patient after the INTAX that, okay, now your contact lens fitting is better. It's not like you spend $1.5 lakh and then you are not spectacle free or contact lens free. So what percentage would you do the INTAX?
So ma'am, basically with the CXL, we all know that around 50 to 60% patient as such have a flattening of more than around 1 diopters, and the visual acuity also sometimes does improve. But it all depends upon what the patient wants. If with the contact lens, the patient's vision is say suboptimal, less than 618, and the patient really wants to go for a improvement in vision, this can be given as an option. The purpose of the study here was to basically assess what is the complication rate, because what is discussed about INTAX is it has a very high complication rate. But if we look at 54 patients being operated, 3 had an explant, overall the complication was not so high. Here it appeared as 12% being high because we had only 24 patients for which the long-term data was actually available. So the purpose was not to see how much it is actually improving, but how much of damage it is doing to the eye.